38-year-old lady presented with 2 episodes of strokes, which we covered except slurring of speech. There was a T which showed a query patent foramen ovale with a right to left shunt. CT angio showed that she had a right lower lobe pulmonary AV fistula, which was documented on the DSA, and here you can see the DSA with a pulmonary AV fistula. It's a big size fistula, and these are multiple angios which have been made to show the fistula. Here you can see the big right to left shunt through the pulmonary AV fistula, and this is shown here. The coil embolization was attempted, so this was going selective into the fistula initially with a diagnostic catheter, but it would slip out, and hence micro catheter with a guide catheter was used to cannulate into the fistula, and coil embolization was done. So this was the first coil which was deployed. You can still see the fistula filling up, and this was the second coil which was deployed. There was still a slight staining, and then another coil was deployed approximately. This was a coil which is coated with fiber to create the thrombosis of the fistula. So this was the coil embolization with 3 coils to thrombose the AV fistula, and then angiography was made to mainly look for the PFO. There is no evidence of any PFO as seen on this particular angiogram. Excellent result, and patient is perfectly all right. There is no problem, and thank you. Patient has done extremely well and mobilized, and here you can